listeners, I am your host Dr. Tahani Zaidi, and today we are going to talk about a very important public health issue, that is cervical cancer, its screening and preventive strategies. And for this reason, we have a very esteemed guest with us, Dr. Uzma Chishti. Dr. Uzma Chishti is a seasoned researcher and gynecologic oncologist in Aga Khan University, Pakistan. Also, she specializes in cervical cancer screening and prevention. Assalamu alaikum, Dr. Chishti. Welcome to our podcast, and we are very happy to have you here.
Walaikum assalam. Thank you very much.
So, we'll start our podcast by asking, you have done so much work on cervical cancer screening in Aga Khan University and as well as, other places, other government hospitals in Karachi, Pakistan. So, can you just tell us why do we have to take these initiatives, and why are they important? Why do we have to talk about them? And also, what is cervical cancer?
So, as you know, that cervical cancer develops in the cells of the cervix, which is the lowermost part of the uterus and the womb. And it occurs due to certain strains of human papillomavirus, which is called HPV. And it's well aware since late 1990s that we know that HPV is the causative agent in most of the cervical cancers. The most important thing about cervical cancer is that it is one of the preventable cancers by means of HPV vaccination and effective screening programs. So that's why I believe that it's very important for our women and for healthcare workers to have a good knowledge about it, and so that we can have effective screening programs and we can prevent this cancer. So, regarding your second question about the work going on in AKUH regarding cervical cancer, so at AKUH we lead the project on Foundation for Health and Empowerment for Women, and in which we are working on cervical cancer. The two main aspects of its working is the awareness of the public and healthcare workers, and as well as the capacity building of our healthcare workers in its advanced training. So this includes conducting workshops in remote areas to develop their skills in advanced colposcopic trainings and in advanced screening training, as well as making some views where we can raise the public awareness as well as the awareness of healthcare workers. Other than this, AKU has the collaboration like with AKU Global and the public sector hospitals to develop their skills and knowledge about cervical cancer, and fostering the knowledge exchange and initiate projects so that we can move further on with the treatment of cervical cancer.
Okay, so your work typically revolves around training healthcare workers and building the capacity so that they can screen cervical cancer even in remote areas where there are no much facilities available.
That's very right. And the other aspect of my work is about creating the public awareness, because as you know that in remote areas people does not know about that some vaccination is available here, and some screening programs are so effective that they can prevent themselves from developing this cancer. So these two are the main areas where we are working currently.
Oh, nice. So building up on this initiative of yours, and when you go and educate the common people about cervical cancers, so are there any myths regarding human papillomavirus, or people's acceptance that there is a thing called cervical cancer? And we know that the vaccination, as soon as early as possible, the girl child gets vaccinated, the risk of having that cancer kind of reduces. So are there any myths and misconceptions or backlash from the community in talking about this topic?
Yeah, I think that's a very relevant question in our communities where the myths prevails regarding the vaccination, as we all know about other vaccinations also. So people think that this vaccine is going to make them infertile or it will not be effective. So these are the areas where I believe the healthcare workers and the community workers should work. And when we talk about these vaccinations to the mothers and the young children, they definitely accept them when we talk to them in detail about its efficacy. So yes, these are the myths which needs the alleviation.
Yeah, I kind of gathered it. So moving on, can you tell us what is the burden of cervical cancer in lower middle income countries, especially in Eastern Mediterranean region, and also how it is different from high income countries? Because we know that high income countries do have cervical cancer prevalence or some of it, but they do have vaccination as well. So how is it different if we compare both the regions?
If we talk about the low and middle income countries and high income countries, there is a lot difference which you can see. Unfortunately, cervical cancer affects disproportionality in low and middle income countries because of the absence of health infrastructure and access to the healthcare facilities is very remote in our areas. So we do see a lot of incidence and mortality of cervical cancer in our areas. While if we look at the high income countries, they have reduced their incidence and mortality both in the last 3 to 4 decades because of this effective HPV vaccination, which is available worldwide, and because of the effective screening programs, which can tell us about the pre-invasive part of the disease. Like one can know about the occurrence, risk of occurrence of cervical cancer years and years before it develops. At that time it is completely treatable, even with fertility preservation. So it's very, very important to do screening.
Yeah. So basically the screening is the part where mortality it's the differentiating part where, you know, because of which lower middle income countries have higher mortality rates than high income countries.
The screening methods and of course the HPV vaccination also, which we are hoping that will come to our country also and to all the Eastern Mediterranean regions.
So I get from your answers or responses that we need research in this area for lower middle income countries. Like we need a lot of research and to gauge perceptions and even at the health system side point of view as well. What are the main areas where, you know, there's a knowledge gap or research gap in lower middle income countries regarding cervical cancer?
Okay. So yes, I do see a critical research gap in lower and middle income countries because we do rely on the data from the high income countries, and as you know, there are some geographical and religious beliefs and differences in these two areas. So the gap I see in the public awareness, in the engagement of the community, in alleviating and discussing the barriers and myths about the screening and the preventive measures, especially the vaccination. And of course, there is a need of doing some research on the policy management of these cancers so that they can be implemented and evaluated and monitored at high levels in all the countries.
So Dr. Uzma, there's a burning question that is coming into my mind. What are the countries, you know, there are some countries that we have heard that have implemented something regarding policy at the national level. So what are those countries and what they have done differently than Pakistan?
Well, it's all about making good policies, taking into account the basic religious and the cultural myths, discussing them, involving all the policymakers into account while making the policies, and somehow at places where we have seen that policies are existing but they are not implemented. So I think implementation is the major challenge in these areas, and then once you implement it successfully, then monitoring them, evaluating them and updating them with the need of the hour is the main important thing.
Yeah, I agree with the point that, you know, implementation has been a very crucial, yeah, exactly. Dr. Chishti, since we are talking about research and we are talking about knowledge gap, so and we know that we need data for making any conclusion about cervical cancer trends or anything of that sort. So what do you think, what are the main sources, data sources for cervical cancer that researchers can rely on, especially for EM region and lower middle income countries alike?
All right. So currently, if we talk about the databases in EM region, we largely based on the national and hospital-based cancer registries, population surveys, hospital information management systems, and the international databases that are available. These resources enhance our capacity to develop qualitative as well as quantitative research, like to look at the public awareness, the quality of life assessment of cancer patients, and more importantly, the impact of these cancer treatments on the community and on the patient. And if we talk about the quantitative research, these data are very useful in creating the local data regarding the observational studies on patients' outcomes and treatments, as well as the public awareness and the data about the take-up of the screening methodology and the HPV vaccinations. So these are very basic areas where we worked on. Furthermore, when we look at the WHO and Globocan data internationally, these data helps us in developing and sorting out the trends in our local areas of this cancer and make further changes in our policies and the screening methodologies.
Okay, so building on the question, do you think that the data is of high quality, or what are the challenges of maintaining such data in lower middle income countries, or some challenges that you faced in accessing this data and understanding the data?
Well, I think that's a very relevant question. So when we look at the local data, we find out data about one institute or a very small areas. When we talked about the trends in cancer and generalizability of these cancer research onto our whole public, then we need a collaborative data. So this is one area where I believe that we should work on, and the collaborative data will give us more generalizable results and will guide us more on our policy making and implementation of those policies.
Thank you so much. So this is the last question, and how can we align ourselves to achieve the 1970-90 target by WHO for eliminating cervical cancer, especially then again talking in the context of EM region?
Yeah, that's a very hot topic, and I believe that we are going far behind on this elimination target given to us by WHO, and I believe that we have to work on each and every aspect of it, starting from the public awareness. So when we talked about public awareness, there are areas where there are tests available, screening methods available. In some areas, vaccination is still not available, but in some areas they are available. So we need to create good public awareness to get the most use of these available resources, number one. Then coming on to the screening methodology and the capacity building. So here comes the role of healthcare workers, where we need to train our healthcare workers, do their capacity building in using these screening methods in the most effective way. And of course, they have got a very important role in the public awareness and healthcare awareness regions also. Then comes the role of the higher authorities in making up the policies. These policies guides us to do the standardized treatment of this very important cancer. And then as we are talking again and again about their implementation, monitoring and evaluation. Along with that, data management, collaborative researches has got their very important role. So I believe each and every component of this is very important to move on in the EM regions further so that we can be successful.
Okay, I agree with the point that we need a lot of work in the policy implementation level. I think researchers like you are probably doing their job very well. And so moving on to the fun bit of our podcast, that is rapid fire questions, and I hope you're ready for these questions. So let's start. You will have a very few time, like a very few seconds to answer these questions. So researchers in cervical cancers, are they difficult or easy?
Difficult.
We had this conversation. I think it's very self-explanatory.
Yeah.
Quantitative studies or qualitative studies?
Both.
Both. Oh, and why is that?
Because this is important that we generate our own local data And it's very important to look at the public perspective, and of course the healthcare workers perspective also, so there is an importance of the quantitative data to look at the trends in our region, as well as it is important to know at the perspective of the people and what impact is going on their lives while they are going through this cancer, or their loved ones are going through this cancer, and what financials and other barriers are they coming across. So quantitative as well as qualitative, I believe both are important.
Okay, so clinical trials or lab research?
Well, at the moment, clinical trials, I believe, should prioritize.
And why is that?
Because in cervical cancer, the clinical trials on the treatment and on the databases is very important, because we are very way behind as compared to the high income countries. Actually, we have to catch up on and unfortunately, most of your answers, I want to say both, but if I look at the priority, then of course, the clinical trials.
So biomarkers or imaging techniques?
Well, both have got their own merits. When we come to the diagnosis, we do need the biomarkers, as well as we cannot deny the effectiveness or the need of imaging. So both.
Research, collaboration or independent studies?
Definitely collaboration.
We have asked this question almost from every guest, and they have all emphasized on research collaboration. So I think audiences should take note.
That's the need of an hour. Yeah.
So this is, I think, of particular interest to you, might be of particular interest to you, epidemiology or molecular biology. What is the need for the time for lower middle income countries?
Again, both, but looking at LMIC's current situation, epidemiology.
Oh, yeah. So, yeah, I think public health researchers are happy for this. Thank you, Dr. Chishti, for joining us, and we had a very great conversation, and I think the audiences have gained a lot from the conversation. So thank you for coming, and congratulations for the work that you're doing. I hope that you keep doing this work, and I hope we achieve those 1970-90 target for WHO. Thank you so much.
Thank you very much for inviting me. Thank you.
So listeners, thank you so much for joining us again this time. I hope you had gained some knowledge or insights about cervical cancer. We'll meet you next time with another guest and with another wonderful conversation. Till then, take care. Bye-bye.